everyone. You know, May is National Women's Health Month, so this morning we're talking about some important tips and tests that you really should be getting. Dr. Angela DeRosa, who has a practice in North Scottsdale, joining us this morning to talk a little bit about what women should be looking at and should be doing. Thanks for being here.
Oh, it's great to be here. And what's really special about this month in particular is it's Women's Wellness and Women's Preventative Health Month. So the good news is that with Mother's Day tomorrow, that we really need to be getting ourselves and our mothers out to get these screening tests because we are so notorious for taking care of everybody else but ourselves.
I was just going to say that. You sort of put it on the back burner, and you really can, especially as we get older. Let's start with the first test that you say is a must, an EKG.
Yes, I mean, we all talk about mammography, and we're always scared about breast cancer, but the #1 killer of women is actually heart disease. So aside from an EKG, there's also another good blood test called a CRP, which is a cardiac risk protein, which is an inflammatory marker, which can help us determine if women are at risk of heart disease. But
at what age?
EKG should be started at the age of 50.
Okay.
And we typically do them annually, but we certainly can do them sooner if the patients have any cardiac risk in their history or if they have family history or other stronger indicators that we should be doing it sooner.
Okay.
But at least at the age of 50.
Okay. We can't talk about this enough, of course, especially here in Arizona, skin cancer. It's amazing. Is it, I think, like 1 in 5 I've heard of someone that you know will have skin cancer at some point.
And the women today are doing very dangerous things. I mean, it's just on the news this past couple of weeks. You have that woman who's been baking herself in a tanning bed. And here in Arizona, we're exposed to sun all the time. And unfortunately, we don't take the proper preventative measures of skin coverage to make sure that we're preventing those sunburns, which we've talked about in another segment. But skin cancer is highly prevalent and very lethal, and young women die from it very regularly. And it's interesting, my very first case was a malignant melanoma, and I found it on the middle of a toe on a 21-year-old woman.
Gosh.
And she died within a year.
Oh my gosh,
so this
that's
is
awful.
Terrible. You should be getting undressed in front of your doctor, show every part of your body, do not be shy, and we gotta look.
Do you go to a dermatologist or your regular doctor?
Certainly your normal primary care physician, family practice, OB, anybody who's trained in medicine can do at least a good screen of the whole body, and then if they see something potentially dangerous, then you should either have it biopsied or sent to a dermatologist who may know more.
I did not know that. Look, I'm learning with everybody else. Pap smears are also very important.
Yes.
We hear about that every year.
And there's so much controversy about Pap smears because there are certain recommendations. Some people say we should get them as soon as women are sexually active, but the newest recommendations suggest that all women starting at the age of 21 should be getting them. And by the time you hit 30, you can maybe move to a 3-year interval, but in our practice, I still think annual screening is needed. And that's something that we just need to do because cervical cancer can be preventative if we get proper screening.
Okay. We know at the age of 40, mammograms are obviously encouraged.
Yes, and there are lots of different recommendations. Some colleges suggest that we start at the age of 50, but certainly at the age of 40, we should get screened, and then annually at the age of 50.
Okay. And then this we hear about men, but a colonoscopy, we don't hear about that as often for women.
Well, colonoscopies, women are just as likely to get colon cancer as men are, and with today's diet, our increased alcohol, environmental exposures, we should be getting colonoscopies, men and women, starting at the age of 50.
How often is that?
And depending on what they find on the colonoscopy, anywhere from every 3 to 5 years if they find polyps or something that needs to be followed, but at least every decade.
Dr. Angela DeRosa, you've been a slew of information this morning because we do hear about the common things, but some of these things are interesting to hear about. Thank you so much.
It's a pleasure. Thank you.
Women, watch your health, especially for this Mother's Day. That's the best gift you can give yourself, right?
Absolutely. We need to have our moms around.
All right. Happy Mother's Day.
Happy Mother's Day.
And happy Mother's Day to your mom, who all she wants is apparently to go to the casino.
I'll see you soon, Mom.